Namaste, I am Dr. Rishabh Tripathee, dermatologist and venerologist. In this short video, I will be highlighting a very common skin problem known as wart. So by the end of the video, you will know the cause of the wart, various types and how it is treated, and if there is any risk of wart getting into cancer. So wart is basically a viral infection. The virus that causes the wart is known as human papilloma virus. There are many types of human papilloma viruses. More than 100 strains have been isolated and their properties have been studied. 40 strains of the human papilloma viruses are transmitted sexually, and other strains are usually transmitted from skin to skin contact. Human papilloma viruses affect humans only. Unlike popular belief, these viruses are not easily transmitted from infected articles or clothes. So what this human papilloma viruses actually does is it enters into the skin cells. So once it enters, the infected cells begin to multiply in a higher rate in comparison to the surrounding normal cells. So after some time, the skin growth is formed because the infected cells begin to grow more rapidly, and that skin growth is known as wart. So wart is basically a tumor. Now the question is whether this tumor has any potential to become cancer, and we'll come to that. Human papilloma viruses usually affect the children and adult, and there are many types of warts. The most common wart is known as verruca vulgaris. The verruca vulgaris or common wart usually infects the fingers and hands. Their size ranges from 5 mm to 1 cm, and they have a very rough surface and grey in color. Another is flat wart. Flat wart is very small in size. Their size ranges from 1 to 3 mm. Their surface is smooth, flat, and the color is that of the skin or pink. These warts have a very good prognosis. They are easily treatable and they usually affect face and back of the hands. Another wart is plantar wart. Plantar wart affects the soles and their growth is inward. Unlike other warts, they do not grow outward. Because of their location on the pressure area, they might be associated with callus and they can be painful. They have a striking resemblance with cone and it's very difficult to remove them. Another very important wart is known as genital wart. So genital wart is caused by the human papilloma viruses which are sexually transmitted. These viruses affect the mucosal lining of the genitalia. Sometimes they might even affect the mucosal lining of mouth and oropharynx. They have a soft, fleshy growth. Their size can vary. These warts do have the potential to become cancer. Sometimes a chronic lingering plantar wart can also develop into squamous cell carcinoma, which is a form of skin cancer. But this is a very rare. The genital warts getting into cancer is very common in comparison. Now let's talk about the various treatment modalities which are utilized to treat the wart. One is cryotherapy. Cryotherapy utilizes liquid nitrogen which freezes the infected cells, and the frozen cells eventually die and clear up from the skin. So besides cryotherapy, some chemicals such as organic acids like salicylic acid, tricyclic acids can be applied on top of the wart, and they also help to clear the wart, but they do not have a very high efficacy. Besides organic acids, some immunomodulator drugs like imiquimod can also be applied, and they do also give a very good response. The most commonly used method to treat the wart is carbon dioxide laser and electrocautery. Carbon dioxide laser and electrocautery is very effective also, and the recurrence rate is also not so high. Some deep plantar warts and giant genital warts may need surgical resection or surgical debulking. Apart from these, immunotherapy is also an emerging option. One of my colleagues had done a research on immunotherapy while I was doing my MD in teaching hospital, and she had found that immunotherapy had given a satisfying result. What is done in immunotherapy is we use some vaccines such as MMR, BCG. These vaccines are inoculated on the wart, and they have to be inoculated at least 3 times in 2 weeks apart. If it works, the recurrence is least. I hope you found this video useful. In the next video, I will talk about the most sinistrous topic, genital wart. Till then, take care, make the social distance, and hopefully stay safe from COVID-19.